Good afternoon, dear guests. Welcome to another Provost Roundtable from Berlin School of Business and Innovation, Post. I am Dr. Nilufar Aminpour, and I welcome you to this roundtable under the topic of the future of healthcare after the era of COVID-19. Before starting this roundtable, I would like to deal with the Provost's biography, a short biography, as some of you need to know more about him. Professor Kyriakos Kouveliotis is the Provost and Chief Academic Officer of the Berlin School of Business and Innovation. He has a PhD in European Integration and International Relations awarded by Newcastle University, whereas he also holds an MA in Diplomacy awarded by Lancaster University, United Kingdom, a certificate in Linguistics awarded by Bangor University, UK, and a BA in English Literature and Linguistics awarded by Aristotle University of Thessaloniki, Greece. He has also completed 2 cycles of postdoctorate research, one on decision and policy making, and one on conflict resolution and crisis management. Professor Kouveliotis has worked in various research groups. He is an accomplished researcher in a variety of disciplines, and in the last 20 years, he has been a provost and taught in many universities and educational organizations globally, among which City Unity College, Newcastle University, University of Sunderland, Carey College, University of Indianapolis, Hellenic Air Force War College, and Hellenic Naval War College, to name a few. He is an expert in developing new curricula, program syllabi, and also in building new global educational networks and partnerships, as he has already done with institutions from the United States, United Kingdom, France, Italy, Switzerland, Ireland, Singapore, India, and Somalia. Professor Koviliotis has created around 100 new academic programs at all levels, supervised a number of 5,000 dissertations, published 12 books, and dozens of original scientific articles. His track record of academic publishing is composed of a variety of papers concerning political, economic, and educational issues. He has also served as a scientific advisor to the Ministry of Defense, to the Deputy Minister of Development and Competitiveness, and to the General Secretariat of Communication and Mass Media of the Greek government. In addition, he was appointed by the Minister of Education as a member in the governing committee of the Hellenic Open University. He also holds various professorships in institutions around the world as Honorary Chancellor and founder of Longford International College in Ireland, Professor at Unitona University in Rome, Italy, and President of Athenaeum Liberal Studies in Europe and in India. Recently, he received a fellowship in the Royal Society of Arts and created in The Hague his own not-for-profit organization, the Global Degree Foundation. Now it's turn to ask our guests to introduce themselves, and after that you will enjoy this roundtable. Please.
Yeah, good day to all. This is Bala Ganesh. I have 21 years of teaching experience. My area of specialization is data mining, web mining, and also artificial intelligence and big data technology, and that Li-Fi technology. These are all my specialization. Thank you.
Thank you.
Hello everyone, my name is Dr. Ahmed Al-Barawi, Doctor of Medicine with Orthopedic Surgery Training. I'm working with BSBI as Lecturer of International Healthcare Management, and I had more than 15 years experience with different fields in business as well, and I'm more than happy joining this discussion today.
Thank you. Good afternoon. My name is Thomas Kanzema. I'm head of HR at BSBI, and my main field of experience is human resources, and in more than 20 years, and in connection with health and safety, 10, 15 years.
Good evening to everyone. So this is Dr. Palni Vel. I am currently working as a lecturer in BSBI. So my specialization of finance. Currently I am handling the various financial modules in healthcare. Thank you.
Thank you.
Hello, this is Marwa Bayali. I'm a medical doctor by profession. I studied public health and epidemiology as well as human genetics. I worked extensively in public health and as well with the implementation of international health regulation with WHO. Supported different countries globally across the last 10 years of my experience. Thank you.
My name is Nadia Anwar. I recently graduated last year from the University Cattolica in Italy. So I was a student of medicine during the highest peak COVID phases in Italy. And so I currently am specializing in gynecology here in Germany.
Good evening, everyone. My name is Saba Shakaliu. I'm sports scientist and sport physical therapist. The main focus of my research is about the gender-specific performances in sport and also gender-specific injuries in sport, and I'm really looking forward to our discussion.
Welcome. Professor, now stage is yours.
Okay, thank you, Dr. Nilfar. I'm very happy to have this roundtable today, and I'm also very happy that we are discussing this after the COVID era. And I always want to organize something similar, not just because we now enter a new phase and COVID is not here with us anymore, but because it's a good opportunity to assess what has happened in the past, what lessons we learned, and also what to expect for the future. So now that the event is not current, I think it's safe to say that there is a new day coming in front of us. And that's why I selected this particular title, The Future of Healthcare After the Era of COVID-19. Maybe there is another COVID or there is another virus, and now the world is definitely much more prepared about everything. So I have drafted a set of questions because our guests here, each one by one, they are specialists in different fields. So it is an amazing opportunity for all of us to exchange this kind of opinions through these questions. And also for me that, although it's not my area of expertise, but I have been engaged in health programs for the last 20 years and created a lot in different institutions. So I've been interacting with more than 1,000 students globally from 150 countries in relation to this kind of issues. And I can also transfer my own experience by saying that nobody has been prepared, as you all know, for COVID-19. But now, because of what happened and because of the experience that we gain, we are 100% prepared for anything else that happens, I mean, on a similar phase. Now, I will start with Dr. Marwa, okay? And I have noticed that you have experience working with WHO. And as you all know, the World Health Organization played a pivotal role in the handling of the pandemic, although it started as an epidemic before. So I have a question for you. When we say all the global healthcare organizations that we know, including the WHO, do you think they learned new lessons after this experience? And is this in contrast on how they handle similar circumstances, pandemics or epidemics in the past? In other words, what is so unique in this particular handling of the crisis that WHO learned, for example?
Okay. So let me start with disagreeing with you on the fact that the virus or coronavirus has ended, because it's still there. So when we are living now a new era, we are living with the virus. The pandemic, maybe the emergency state has ended, but we can expect that maybe a new variant happen or any other virus. So that's just as a start. And then the second point to highlight also is the difference between healthcare and public health. So public health is the big picture, where healthcare is part of this big picture. So if we talk public health, we talk also health policy, we talk other things. So in that sense, the global organizations that are supporting health and healthcare across the globe work usually with the countries, have, I think, achieved one particular major lesson, which is cross-cutting collaboration. And that's the major thing that we have to agree on. And then following that, and during this process of multi-sectoral and cross-cutting collaboration, they realized the importance of information and agility. So both are working together. Without information, you can't be agile. And this also reforms somehow a way of adopting innovation from the people, from each sector, from the people on the ground who are dealing with day-to-day problems, and then taking these approaches, these innovative approaches, and using it, utilizing it at a global level. And then maybe the last thing to highlight is the political will, because without the political will, there would have not been the achievements that we achieved right now. So that's in a nutshell, maybe few lessons to highlight.
You are so right. Actually, the COVID-19 is still with us. The emergency stage of the pandemic is over, but as we have learned to live with other viruses, this is how our life is going to continue as well. And also, since you mentioned the political dimension as well, This has been probably the most large-scale experiment of global decision-making and crisis management handling, plus the vaccinations and everything else. Because that was an experiment, let's say, or a process that was applied to millions of, let's say, billions of people. And changing now or shifting to Dr. El-Barawi, do you think that COVID-19 was also a trigger for developing more healthcare issues and challenging?
Well, the healthcare systems globally were already suffering from main issues, including the accessibility to the healthcare system from patients' perspective and populations, the waiting times, the neglection for many years and decades of underinvestment. And let's say the COVID-19 was a trigger to shock healthcare systems around the world, to add more complications and issue to the current situation. For example, the healthcare workers themselves, they have been affected by the COVID-19 and being infected, which had led to more shortage in the healthcare workforce. Moreover, the patients themselves who were waiting maybe for elective treatments and so on, the hospitals were only focusing on the emergencies, and that had led to longer waiting time as well for the patients and reduced their accessibility to the system. The supply chain also have been affected around the world, whether we are talking about development of the healthcare equipment, the medical supplies, the consumable medical supplies, including the medicines itself as well. The economic state we reached because of the COVID-19 also had pushed the situation of underinvestment and underdevelopment of the healthcare systems as well, which is leading to more complicated situation we can see. I think from my point of view that the only sector shows some development is the IT sector. Those are part of the complications and issues healthcare systems are facing right now because of the COVID-19.
Okay, that's an interesting perception, thank you. You're also a medical doctor, and it's very important that you manage to combine your managerial with your medical knowledge as well. And I'm coming now to your colleague, Dr. Anwar, who is also a GP. And my question is, your studies in medicine, do you think there was some kind of an impact during COVID-19? So what we're talking about is a practical part of that. And was it successful in comparison to those that they did after the lockdown?
I would say that, first of all, the COVID pandemic affected about 1.7 billion students worldwide, profoundly the healthcare sector with nursing, dental, and medical students. And we would say that for our students, our training was disrupted with constant delaying and cancellation of classes, where we were not allowed to conduct in-person training. So we had an imbalance of theoretical knowledge throughout the COVID pandemic, where all lectures were pushed online in comparison to in-person training, where post-lockdown we were allowed to be in hospitals, but with very limited patient access, and we were only allowed to do the most basic simple tasks. But there was also progresses in terms of medical care during the pandemic. We saw the use of technology being used in hospitals, for example. Prior to the pandemic, now we see the use of remote ICU monitoring, where now we can also monitor patients in rural communities in hospitals that are not tertiary centers. And this allows these patients who usually were not receive specialist care, they are now able to receive specialist care. And in patients with like telehealth medicine is now an upcoming development, and during COVID we saw the use of telehealth medicine with where we conduct care virtually. And so this was a new aspect of medicine that was not part of our curriculum, and during the pandemic the universities had to change how they would teach us, and we had to relearn how we communicated with patients. And so I would say that although practically there were some downfalls, there was a new advantage, so to say, in COVID, where these were not considered in medical training, and now this is part of the medical curriculum, and it's currently being implemented worldwide now.
And I think some of the things that were adjusted to the new situation, they are here to stay. For example, part in remote learning, or use of Web 3.0 technologies in medicine, or some specialized software that they design, and all these kind of things. Now, and all these, they have, of course, a financial cost. And coming to finance, Dr. Palanivel, as an expert on finance and economics of healthcare, my question is, were the healthcare system suffering from financial loss challenging before COVID-19? And what I want to say is that before we had a certain economic difficulty in financing healthcare system. But because of the pandemic, a huge financial boost globally by governments entered all these health organizations. And now I need your assessment in regards to what happened before and what is going to happen after, in the stage that we are now. So what do you think governments will do? They will continue to support healthcare systems and organizations or not?
Thank you, Professor. So yes, there is a financial challenges before the COVID-19. Each and every region, there is a different kind of financial challenges the society peoples are facing. There is some common challenges. So what are the common challenges means the increase in the medical cost. Why it is increased? Because in the medical healthcare, so we are using the highly skilled labors like doctors, nurses. So all the employees comes under the highly skilled labors. So obviously we need to pay more for them. So that is the one and only the reason, first one. Then apart from that, so we are using the highly advanced technology. Before COVID-19 also we used it. For the advanced technology, we need to pay more. So these are all some common reason. Then apart from that, another challenges. So each and every region, there is a disparities in the healthcare resources. So each and every country, we are not supposed to access the same kind of care. So there is a disparities in the income, geographic, environmental, as well as the last one, the insurance coverage policy is also differ from the region to region. So that is the reason before the COVID-19, we are faced some financial challenges.
That's correct. And Dr. Al-Barawi mentioned the connection of information technology to healthcare. So Dr. Balaganas, what I'm going to ask you now to bridge this is that how advanced the information technology usage in the healthcare facilities was before COVID-19?
Yeah, before COVID-19, the usage of information technology in healthcare system facilities, it's advanced. So but it's vary case by case, different region, different countries, and different healthcare industries having it's varied. How it's varied or whatever it is, around 2015, healthcare industry, it's enabled, it's advanced, like lot of communication channels and technologies, like electronic healthcare and electronic health records, then health information system, then health information exchange, decision support system, then many of telemedicines, and also it's with what you mentioned about the telemedicines, and also mobile applications and remote networking, remote monitoring, and also having that data analytics. All this area, it's advanced. But the problem is, as we know, prevention is better than cure. But the thing is, what happened earlier, before COVID, what happened exactly, they are mostly focused on curative area, curative support and curative care. They are not much concentrate in preventive support and preventive service. That's what I feel it's lack in that IT field in that before COVID. Thank you.
Thank you. Mrs. Saba, you are an expert physiotherapist, and I'm going to ask you a little bit strange question, but I think it's very related. What was the incidence of sports-related injuries if we compare it before COVID and now? So in your field, was there any change?
Yes, scientific studies show very different results, depends on sex and gender and also on professional level of athletes. For example, there is no increase of match injuries after lockdown and restart of the male football season in 22. And on the contrary, female athletes, female football players showed a much higher incidence of injuries after lockdowns. I would like to highlight that because of the variety of reasons, female athletes and in general women, they had less access to specialist facilities and equipments to maintain their fitness level during isolation in compared to their male colleagues. And it is well established that sudden increase of training load can it increase also the risk of injuries. And I think the Swedish women football league is a great example for that. They reported a much higher incidence of knee injuries, especially ACL injuries among female football players at first 5 games of the league in compared to their male colleagues. In general, we know that women showed a higher stress and also higher anxiety level in compared to their male colleagues. And the level of stress and the level of anxiety affects our quality of sleep. Quality of sleep plays a crucial role in sports recovery and also in risk of injuries among athletes. And there is a very interesting study from Spain that shows that women had a lower quality of sleep than men during lockdowns and during the pandemic, and the relation between the low quality of sleep and the risk of injuries among athletes is well proven in sports science. So if you're talking and evaluating the risk of injuries, we have to always consider so many factors like gender, social status, and the level of players they are playing.
What you mentioned about the quality of sleep, I didn't know that there was such a connection.
Yeah.
This is very interesting.
Now, we monitor the quality of sleep of our athletes regularly, especially in professional levels.
And by this, and before I pass this to Thomas, it will be an excellent paper for you to submit to our journals to publish, because it's a very unique connection. So thanks for the insight. Thomas, as an expert of HR, I'm going to ask you a related question to this. So what is the current status at the aftermath of the pandemic in regards to health and safety in the workplace? So what the pandemic changed on the places that we work and how we meet people in the working environment and what we do here generally?
This is a good question. As already mentioned, the pandemic period of COVID-19 is over, and the strong legal protections against infection in the workplace ended 2-3 months ago. So I discovered 3 trends, but I was also working in the last 2-3 years in different companies, and I discovered a change in the working place by itself. Let's say the majority of my colleagues or friends, they started to work in the home office, and now let's say they try to return back to work, and the companies let's say they want to make the working place more attractive than the home office place. So I discovered 3 trends regarding health and safety. I don't want to go in too much detail on the different companies. So one is investing in mental health protection. Considering the experience we all made during this pandemic period, from one day to the other, for example, I was working in retail, every store was closed, and we had panic. How would we, let's say, pay our rent, pay our family, pay the school, and everything? It became dramatic. So this is one, let's say, occupational care. A good employer should take care for the health protection, and then on the other hand, investing in quality physical protection. What does it mean? Usually, let's say we are working in the office, we are not hard worker by hand or by food. We work with the brain, sometimes with the hand. So we have to protect our worker when they are outside under construction. This is one part. Let's say the health and safety companies are taking care for. And then there is the third trend is called MSD and remote injuries prevention. Looking at the new working places, you will discover working from home is quite different than working in the office. In the office, you meet your friends or colleagues, sometimes they are friends, and so you have this psychological contact that is missing during the working place, and there's no line manager who's taking care of your health and your, let's say, your body language, how you're sitting there. You have to manage yourself, and this is also a new sickness that is discovered. How often you work at home, and there's also another part that is a stress part, because when you're working at home, some people have the impression they are not working enough, so they stress themselves to work more and harder because they want to show their line manager their best performer.
Oh, they do that? Interesting. If you know some of these people, bring them here.
Someone is sitting close to you.
Okay.
No, it is a quite different working environment, and it doesn't say you as an employer have to offer home office, because it cannot work everywhere, especially at school. In our business school, you have to be present.
Especially medicine?
In medicine.
Unless you have telepathic qualities. Okay.
It's quite difficult.
Thank you very much for this, Thomas. And I'm coming now to Dr. Palanivel again. And since BSBI is organizing its first conference on artificial intelligence next month, and we have our own robot that we are building, I'm going to ask you a related question, try to bridge this. So, did both COVID-19 lockdown and artificial intelligence booming, as you currently know, develop the healthcare financial pooling component of different healthcare systems globally? How these are combined together?
Thank you, Professor. So a little bit complicated question to answer this.
That I told you before I asked. Okay.
So both the COVID-19 lockdown and the artificial intelligence booming, it is interlinked with each other. So there is a positively and a negatively impact to the financial pooling. So I will explain both the cases. So first I will explain the...
Explain like we're students. Okay.
Sure. So in the first one, the COVID-19 lockdown. So in the COVID-19 lockdown, so most of the patients need more medicine. So there is a lack of resources, medical resources. Because of this, most of the companies need to produce more kind of medical kit as well as the life-saving equipment. So because of this, the financial pooling is increased. Then in the negative case, in the COVID-19 lockdown, at the time of the COVID-19 lockdown, most non-COVID-19 treatment patients are postponed, some regular checkup. So only the COVID-19 cases patients are taking treatment in the hospital. So in this kind of industries are earning more financial resource. Other industries like physiotherapy industry, you can take it as an example. So no one is coming to do any kind of physiotherapies. So non-COVID-19 industries are not getting any revenue in this situation. So now I come to the second question, the artificial intelligence booming. So definitely the artificial intelligence are providing the more efficient in terms of allocating the proper administrative resource, how they are making the billing properly, so how taking the efficient treatment to the healthcare facilities. So because of this, there are a huge advantage when we are implementing the AI in the healthcare. So what are all the negative things in the AI booming? Obviously, we need to update our technology in our current industry. For this, we need more investment. We need more capital. So you know very well in the hospital industry, there is lack of generating the liquidity. Most of them in the developed countries, everybody is doing the treatment under the health insurance. So after 3 months, after 2 months, the hospitals are getting the what they provided the treatment to the patients. So there is a capital inadequacy. The hospitals are very challenges to invest in the AI.
So that means more capital and financing is needed.
Yes, exactly.
I think the finance ministers will love you, especially at this time. Okay. Dr. Balaganes, of course I'm going to ask you about artificial intelligence as well as an IT expert. And I will ask you a question that is on everybody's head about this rapid growth. So, are healthcare systems becoming, from now on, artificial intelligence dependent, or can be functioning as without any IT support, so generate knowledge on their own, or there is another scenario that we don't know yet? How it's going to be developed?
Without artificial intelligence can't be. Absolutely, artificial intelligence plays a very important role to that healthcare system. It's an undoubted thing that healthcare system, it's really need that very important role from that artificial intelligence. Artificial intelligence, there is a 3 level of intelligence are there. One is artificial narrow intelligence, another one is artificial general intelligence, and third one is artificial super intelligence. All this intelligence, it's really adapt and enhance to the technology like electronic health record and computerized provided order entry, and also there is so many other technologies like RFID, radio frequency identification, picture archiving communication system, and electronic material and management, and barcode, and interoperability. All this area, artificial intelligence, it's played that important role.
Because I have read somewhere that, let's say in a year from now, instead of calling your GP, you will call a chatbot asking you certain questions. And then you can get a feedback exactly the same as from your doctor.
Yes, exactly.
I'm not going to say my personal opinion on this, but is this something that is
absolutely,
coming?
Professor.
Because
what
for the
mentioned,
legal services, it's already there.
Absolutely,
but
Professor.
Now we're talking about health.
Yes, regarding that health also, like we are getting that record, data, information about the patients, about that easy to accessing their information and record, which is really helpful to analyze and can make it more, give the proper information. That's really helpful. Because of the data analysis, deep learning, it's really helpful to give the proper solution to them.
And of course, what remains to be seen is that all these data that are collected, especially by the use of chatbots, who is controlling them, who is collecting them, who is going to use them, and I don't want all my personal medical data and this kind of IT interaction to be stored in a private health insurance servers somewhere and then start receiving messages. I don't know.
No.
Anyway, Dr. Nadia, as a physician, are the changes happening to the healthcare system globally today facilitating also health professionals integration and immigration? So it is easier now to go to other countries and work. So is medical, let's say, globalization, if I permitted to use this term, is happening more often now?
Yes, we can see an increased trend over the past decade of medical professionals leaving their country of origin to work in more developed countries. A lot of early career physicians, they tend to choose countries which have a more robust residency system, which also equals to a better salary in comparison to their home country. And when we look back on the COVID pandemic, we see that a lot of countries are reliant on foreign healthcare workers to mitigate the gap that is lacking with the lack of skilled healthcare workers in their country. So in certain countries where there is a aging population, and so they require this migrant workers to fill in the gaps, to care for the healthcare system. And we can see that here in Germany, 20% of doctors are foreign-born, and 16% of nurses are also foreign-born.
And Germany has an aging population as well.
Exactly. So these are countries that are heavily reliant on foreign workers, and so, but if you compare to, there's a disparaging health inequity with where these healthcare workers are coming from. So where in their country of origin, the remaining healthcare workers would then have to support and burden the healthcare system in their home country. And so a way that a lot of countries are tackling this is through the development of technology. And so when all the countries are able to develop these technologies, for example, in India, in regards to the ICU, during the pandemic, there was a study where they implemented remote ICU in 800 beds. And so instead of specialists taking care of 10 patients in person, they are taking care of 80 persons remotely. And the study shows that because of this virtual care, they are able to provide care to rural areas. And so this not only mitigates the costs of hospitals where these patients do not need to be hospitalized in tertiary centers, it also allows the patients to have a shorter stay in this ICU and a faster turnover period.
Interesting, very interesting. Now, Dr. Beyali, I think the question I'm going to ask you is customized on you, and you will understand why. So, how sensitive are both people and healthcare systems now going to be in the case of a future pandemic? And how healthcare systems are prepared for? Because, okay, maybe the next pandemic, touch wood, is not exactly like COVID-19. Maybe it's something else with different symptoms and different developments. So, are we prepared now? Can we be 100% certain that, okay, we're more wiser, but operationally speaking, are we now prepared?
It's a difficult question, and I'm just speaking from my own experience. So I think that the snowball effect of knowledge generation through the different pandemics that we go through is already growing. So today we are wiser than yesterday regarding how to prepare, how to react in future pandemics. But are we ready? That's the question. That's the important question. So we could be prepared in some areas, in some sectors, but we are not ready. So there is an element that is still missing, and we still need to work on to get everyone in a position to react, to be ready through training, through getting more sensitized to IT, to technology, and how to use it in a rapid way, to getting to know also the pieces of knowledge that are needed to react in time. So that's one part. And then we come to people. Are people more sensitive? Are people more ready? Are people more prepared? I think with the current situation, with the pandemic, with COVID pandemic, and the following pandemic, which happened already, the monkeypox, or mpox, the people got more aware of the state of outbreaks of diseases and so on, and everyone is having his own approach or her own approach and educating themselves and taking the right approaches. The key word here is sustainability of educating people, promoting health and promoting healthier behaviors.
So should we integrate this in the curricula, let's say on the primary school or high school, like community nursing, for example? I'm not talking about first aid. I'm talking about public health prevention, for example.
I think that should be mandatory in all stages of school, and then also in the medical professions, because I think it's lacking right now the public health perspective and the medical education that we all go through. So we go to the market or to the work as a GP as a start, and then you get your specialization. You don't know how to report a case if it is a weird, suspicious case that could be the case zero for an outbreak.
From your experience in the World Health Organization, do you think that in the beginning, taking back a couple of years, we underestimated COVID in the beginning? Because we all know what happened afterwards, but in the beginning, when this thing started and we were looking like it's an event that, or an incident that happened in a remote place from Europe, or you think we underestimated?
It's not an underestimation as much as it is I'm safe, and as long as I'm safe, I don't care what happens elsewhere. And that has been proven wrong. So unless everyone is safe, I'm not safe. So, and this, I think, was the trigger for the collaboration, which I mentioned at the beginning, the huge cross-sectoral and cross-sectional collaboration around the world to mitigate the risks and to mitigate the complications that we anyway have seen some of them.
You know, when the term globalization was initiated, I think by Dr. Susan Straits in Warwick University a couple of decades ago, they used to define globalization with an analogy. They were saying that when somebody coughs in New York, somebody else gets a cold in Hong Kong. Mm-hmm. But literally, this is what happened with COVID. So this medical, let's say, parallelism happened in reality. Mm-hmm. So, Ms. Saba, is COVID-19 then reshaped people's lifestyles in a sense it did? And how women particularly benefited from this moderation of lifestyles? I remember what you mentioned about injuries and everything, but regarding lifestyle, what changed? Which is here probably to stay.
It's definitely a hard question to answer. In general, we can say there was a significant decline in physical activity and social activities between men and women. As Thomas already mentioned, many people had the privilege to work at home, and this privilege brings advantages and disadvantages for both genders. However, we didn't, there is no report about different nutrition behavior. And also, if we want to answer this question, we have to consider many aspects, and we have to consider, for example, the gender and also the social aspect, and also whether people are single or not single, or whether they have an immigration background or not. That also, COVID had a different effect on all of us. But what I think is COVID is the best example why we need more diversity in science, especially in medicine and sports science. The obvious example would be the differences between both genders. In the past, the scientists believed that men are better participants for scientific studies if they were examining new drugs or new treatments. They believed because of their menstrual cycle and because of the ability to get pregnant, they do not make a good participant. And on the other side, they applied the outcomes of those studies exactly on women. And as I said, COVID is the best example that women are not small men. We have different immune system. And we react to different social stress differently than men. For example, from one side, women had a showed higher level of stress and anxiety than men, and from the other side, we see higher rate of death among men, because it is proven in medicine that women have better immune system than men.
They have many better things. For example, by definition, it's an upgraded model because they were created on the second stage. So everything is by default. So we have to try and learn this the hard way. So dear Thomas,
thank you.
What should be the changes for health and safety in the future if another pandemic happens? So should we find a new version of home office, hybrid, with holograms, with artificial intelligence? Let's hope that we don't have to face the situation, but let's say if we do, what should we change in your domain?
This is a good question. Okay, I don't want to let someone work for me, not artificial intelligence in the office. No, I would distinguish on one hand between the companies, each single company, and those companies who are, let's say, professionals in health and safety. All companies should, let's say, work from their experiences to the pandemic period, and they have their special hygiene plan, and also let's say the protection plans that were on place. They should develop them.
Like protocols.
Protocols, or I did it in the previous company. I tested everyone each morning because nobody took care about it in order to protect the others. And so you need to have a good protection management. And then on the other hand, those companies who are the professionals in health and safety, they during the pandemic periods, they were not able to visit the companies, their clients. So now they started a new, let's say, new utilities to do it via video call, and this is something they should work on. And then, of course, you mentioned the home office. It's always, I think it's always a decision of each single company how often employees should be able to work at home or should be present in the office. And I have similar experience that I heard from friends. Some of them were 1.5, 2 years in home office. So some of them, they had a big distance to their previous colleagues, and there was something missing. Of course, they lost the line, they lost sometimes their job, and this is something the management should take care of, that there is a good distance and also a good solution for everyone. Because not each single employee is eligible to work at home. Sometimes they need.
So they also lost their jobs.
Yeah, they lost their jobs also.
At least they stayed home.
Yeah.
Okay.
But I'm not ready. And then the stress of digitization. This is important. On one hand, it is a big benefit. We see a big advantage that some projects are done very fast. On the other hand, it's a stress factor, because sometimes you need to work faster and faster and faster. I had a period in my working life when I was receiving 250 emails per day, and it was a really high stress factor.
I don't know what to wish for you to reach a new record here. or less, or you can take some of this at home. But I can understand you because I receive similar numbers. So it is also a little bit stressful.
Yeah.
But as you rightly said before, you have this magnificent mental health program to assist. Okay, coming back to you, Dr. Ahmed, and closing now. What are the factors to be considered in the future for any healthcare system to succeed? And I ask you this question because you have a mixed experience as a doctor and as a manager. So you need to take into consideration the lessons of the pandemic, the impact of IT, the impact of artificial intelligence, the lack of financial resources that governments should continue to bring in, and also what the future is going to bring, because now we are talking or we're entering a stage of deglobalization. And that will bring also the attention back to the states themselves. On the other hand, now countries are trying to create alliances in a geographical proximity, not as it was before. That means also for production or for services. So what is going to be the future?
Thank you for this question. Actually, for deglobalization, I totally agree with you, except for the healthcare, which is improving the globalization, as we could see. Each healthcare system, it needs to have key components to be successful. First of all, I would agree with Dr. Marwa about the democracy and the political willingness that we need really to develop our healthcare system nationally, regardless which country you are talking about. That will help any nation to be involved with all society layers to be participating in the development of their healthcare system, including their public health education, including their healthcare professions development, since young age, the childhood, what do we educate them regarding their health in the schools? And that really needs democracy. This is the first component. I totally also agree with Dr. Palanivel regarding the financial pooling, which is really important for any healthcare system to be sensitive enough for any situation we are facing, that we have enough overview for our financial situation. If we compare it with those systems who are depending on scattered financial resources, it could lead to failure as well. The medical supplies, this is the part related to the deglobalization, where some nations now are suffering from outsourcing their medical supplies. Like we could see right now here in Germany, we are calling for collecting leftovers of pediatric medications because we are not producing inside the country those medications.
Of course, sometimes we need to face cases like there is a pill that people with diabetes are taking, and somebody discovered that you can also lose weight, and now they are short of this particular medication. So these are the things that we need to deal on everyday basis. Now,
it's a perfect example.
I have a last question, which is the same for all. So let's have a final round, and for by definition is going to be general, and it's partly answered by you. So how do you see the future of healthcare globally in general in the next couple of years? Let's start with you, Dr. Balaganis.
Yeah, as Dr. Benjamin and Franklin said about an ounce of prevention is worth a pound of cure. Like artificial intelligence and IT, they have to use, it will be more useful to use in the preventive approach. Preventive approach is the proactive approach. Using that approach, it's a top-down approach. Using that approach can every day, as the professor mentioned, a daily routines to monitor. So it's really helpful, daily routine monitor and given the alert information to every individual. It's really helpful, and it's provide that proper information to that every individual. It's given to avoid that disease. Most of the disease we can possible to avoid. That's the thing, it's artificial intelligence, it's really helpful using that wearable technology, virtual care technology, like different kind of this technology, it's really helpful to handle this thing. That's what I think.
Thank you. Dr. Ahmed, any last remarks on the future of
I can see
healthcare?
the future of healthcare that it's going to become more complex. People are getting more aware of the diagnosis, the treatment. They are just asking ChatGPT maybe or other artificial intelligence about my case, then give me diagnosis and prescribe me some medication, and that will add more load to any healthcare system worldwide.
Yeah.
This is how we can
Let's
see it.
leave GPT not to give us predictions of our health.
Many people are really using artificial intelligence to guide them regarding their health situation.
I hope doctors are not using it, but anyway.
Not yet.
I agree with this.
So, Thomas, any last remarks from your side in regards to the future of healthcare, especially in the business environment?
Yeah, I think as I also mentioned, if each single country is collecting all the data, all the experiences, and communicating within the European Union, within worldwide communication, I think this is, let's say this is a goal that I would see in order to have, because we have a worldwide economy, and a worldwide economy, employees are traveling, managers are traveling, people are traveling, products are traveling or to be transferred, and this is also, let's say, a transport of pandemic infections. And a good communication system and a transparent one, I think, would be needed to let's say, to solve the next pandemic period together.
Okay, thank you. Your perception?
Yeah, my perception about the healthcare in the future, raising the healthcare cost, it is not possible. So it is rising day by day. Then second one, the value-based payment model. So it is going to start. The government is also thinking about this. So based on the outcome of the patient and the quality of the healthcare. So based on that, the payment system will be following. Then healthcare technology investment will increase in the forthcoming days. Then financing innovation. In the healthcare system, always we need a huge amount of capital. So the hospitals are trying to following the sustainability in the finance.
I think, as you know, most health systems is a mix of the Beveridge and the Bismarck healthcare system, and that from now on I think it doesn't work. Whereas for me it doesn't work Medicare and Medicaid in the United States as well, where you have serious issues if you are not insured, for example. So maybe starting by the WHO, we need a different forum for putting all these things down and maybe create an organization specialized in this kind of policy making. Not just as a step in preparing for the next pandemic, but we need that all health systems around the world have issues, huge financial issues. So if in your area the pandemic taught us something, is that we need a collective action. As we did with the vaccination and all the other policies, we need also for this.
Yes, exactly.
So any thoughts for the future of healthcare?
So in my opinion, I think that health and healthcare in general will be more automated, digitized. So I see that. And I see that health education across the different levels towards people or towards professionals will be more customized as well, to be more competency-based. And then I see that in general we are moving towards human-centered healthcare, and human-centered is not patient-centered, it's beyond. So training is specific and it's more taking in consideration disparities. Risk communication with public is taken more in consideration minorities. as well as financing as programs, reaching the vulnerables, reaching the hard to reach. So in that sense, we are more going towards universal health coverage, which may be a solution, but this has to be tailored for each country as per each case and for each government.
And when you mention human-centered and not patient-centered, I think it opens also a huge door for marketing to step in, whatever that
true.
means.
Yeah.
So still then we can safely say it's also a transitional stage of where we are now, and maybe because of the pandemic everything will happen faster. Who knows?
Yeah, the thing of acting fast because there is an emergency is a human thing, so we fight or flight, but then we remain dormant in the rest of the time, and that's the problem. So sustainability is a real issue that everyone needs to deal with, like climate change. We are living it right now, but still little has been done. So sustainability of action, I think, is a key.
Yeah, let's hope it's not too late. Any last thoughts for the future of healthcare?
I would say that now we see that IT is crucially integrated in healthcare, and so many institutions and hospitals now have to adapt and train their healthcare workers and students simultaneously so that they are better prepared. And we can see that now in many surgical fields like orthopedic and cardiology, many robotic instruments are used, and in universities now we see the upcoming rise of students using virtual realities to practice surgical skills. And so this is a new up and coming topic, and so it's quite important that although we find a balance between virtual reality and inpatient care, this hybrid type of care would become the norm in the future.
I had a personal experience. I had to do a robotic surgery a couple of months ago via the Da Vinci device. So I was, and everything in 20 minutes goes over, and then you can even go home. But I was so excited of seeing this robot and everything, not live of course, that I forgot the whole thing about the surgery. So as an experience, it's amazing. Although if you see it, it's like scary.
Yeah.
But that was unimaginable even 5 years ago.
Yes, exactly.
And you know, the doctor can actually be on another continent operating there. So that's one of the differences, let's say, with laparoscopic surgery, is that there you have 3 holes, let's say, in your body, for on the camera and for the doctor to operate. In the robotic surgery, you have 4, and the 4 is for a backup doctor. Maybe the internet goes down, maybe something else happened to the other end of the planet, you never know. So, okay, it's like you have 4 bullets in a row, but it worked, okay, since I'm here with you. Okay, any last thoughts?
I only worked in German healthcare system, so it's the German view. I think Germany needs a more sustainable policy in healthcare, and only relying on qualified immigrants coming from other countries and helping the healthcare is not a sustainable solution, because it causes other countries problems. So borrowing or stealing qualified staff from...
I'm not going to comment on that.
Yeah, it's not a sustainable policy. So we have to motivate also more young people to get into those jobs. They are mainly not that well-paid jobs in compared to the hours of working in medical staff. And speaking of from my generation, we put lots of importance on the flexibility and work-life balance, which healthcare jobs do not provide. So we have to also change our work policies to have more personal in healthcare.
And I think then BSBI is on the right track, because we are embarked upon health programs as well, and who knows, maybe in the next couple of years our own medical school. So
that would be great.
So thank you all for being here today and discuss this issue that is not easy, as you have seen, but I think we try to merge all these different disciplines of yours quite effectively. And to our audience, thanks very much for attending, and hope to have you all with us in the next Provost Roundtable.